Hi everyone, in this video we will discuss the angles classification of malocclusion and about why we need this classification, what is line of occlusion. In this picture you can see who introduced this classification and what is class 1, class 2, class 3 of malocclusion. Why we need this classification? Why we need this classification? We need this classification for the grouping of orthodontic problems, for the location of problems to be treated, for the diagnosis and treatment plan, for the comparison of different types of malocclusion. As you can see in this picture, they are different. In this colorful fishes picture you can see class 1, class 2 and class 3. They are different types. You can now compare also. For self-communication, we need this classification. This picture is showing diagnosis, this picture is showing comparison, and for epidemiological purposes. For documentation of problems, we needed this classification for use of epidemiological studies. This classification is helpful for the assessment of treatment effects for orthodontic appliances. Introduction. Who introduced this classification? This classification is introduced by Edward Engel. Edward Engel introduced a system of classifying malocclusion in 1899. This classification is based on mesiobuccal cusp of upper first permanent molar and mesiobuccal groove of lower permanent molar. As you can see in this picture, the relationship is shown. Angle classification of malocclusion. Engel classified them into three classes: class 1 malocclusion, class 2 malocclusion and class 3 malocclusion. Class 1 has no further divisions as compared to class 2 and class 3. Class 2 have 3 divisions: division 1, division 2 and subdivision. Class 3 has class 3, pseudo class 3 and subdivision. Class 1 malocclusion. Malocclusion. Class 1 malocclusion is the same as normal occlusion. This statement shows the mesiobuccal cusp of first permanent molar occludes with the mesiobuccal groove of the lower first molar, but the line of occlusion is incorrect because of malpose teeth, rotations or other discrepancies. In the given picture, in which the molars are yellow, you can see it has the molar relationship is the same as normal occlusion, but the line of occlusion is incorrect. And why? As you can see in this picture, there are malpose teeth, there are rotations or other discrepancies. In the given picture below, you can see there is a cast. These are dental casts and both arches are given, and you can clearly see the right and left molar relationships, and you can also see the line of occlusion. This is class 1 malocclusion angle. In the class 1 malocclusion, as we have discussed, the line of occlusion is incorrect. So you know what is the line of occlusion? It is a smooth curve passing through the central fossa of each upper molar and cross the cingulum of upper canine. Cingulum of upper canine and incisor teeth. The same line runs along the buccal cusps and incisor ledges of the lower teeth, thus specifying the occlusal as well as inter-arch relationship once the molar position is established. This is the line of occlusion. In the given picture, you can see there is a red line. In the maxillary arch, you can see the red line is passing. Where it is passing from? It is passing from the central fossa of the molars, and it is crossing molars. You can see premolar and molars. It is crossing the central fossa, it is crossing the cingulum of canine and incisors of the upper teeth. And the same line in the mandibular arch, you can see the same line runs along the buccal cusps and incisor ledges, buccal cusps of molars, premolars and then incisal edges of the lower teeth. Class 2 malocclusion. Class 2 malocclusion, the mesiobuccal cusp of the lower first permanent molar occludes distal to the class 1 position. As you can see in this given picture, the molar, the lower first permanent molar, occludes distally to the class 1 position. In class 2 malocclusion, there is an overjet. You can see what do you mean by overjet? In class 2 division, condition when class 2 molar relationship is present with procline upper central incisors, there is an increased overjet. In class 2 division 1, because of the proclination of the upper central incisors, an overjet is the extent of horizontal anterior-posterior overlap of the maxillary central incisors over the mandibular central incisors. Class 2 division 2. In class 2 division 2, you can see what is this condition. In this condition, when class 2 molar relationship is present with retroclined upper central incisors. In the picture, you can see the upper central incisors are retroclined, and upper lateral incisors are also retroclined. And the overjet is usually minimal or maybe increased. It may be increased, but it is usually minimal. Class 2 subdivision. It is a condition in which class 2 molar relationship exists on only one side, with normal molar relationship on the other side. In the given picture, you can see the arrow indicating that there is class 2 molar relationship, while on the other, this is the right side, you can see there is normal molar relationship. Class 3 malocclusion. What is class 3 malocclusion? In this, the mesiobuccal cusp of the lower first molar occludes mesial to the class 1 position. In the given picture, you can see the molar where it is occluding. It is more mesial. The lower molar is more mesial as compared to class 2. If we think about class 2, so let's see, the molar is occluding distally, okay, but in class 3 the molar occludes mesially to the class 1 position. And the given cast, you can also see the relationship clearly, while in the picture you can see it more clearly. Class 3 subdivision. In class 3 subdivision, this condition in which class 3 molar relationship is present only on one side with normal relation on the other side. As you can see, the class 3 subdivision, class 3 molar relationship is present on the right side in the given picture below, and a normal molar relationship is present on the left side. Pseudo class 3 malocclusion. It is due to occlusal prematurity. When the mandible moves from rest position to occlusion, it slides forward into pseudo class 3. Pseudo class 3 is also known as postural class 3. In the given picture below, you can see in this condition clearly. Now we know what is class 1, class 2 and class 3. We can see clearly in class 1 malocclusion, class 2 malocclusion and class 3 malocclusion. What is the molar relationship? Class 1 has normal molar relationship as normal occlusion, but class 2, you can see the lower molar occludes more distally, and in class 3 you can see the lower permanent molar occludes mesially. So this is the molar relationship, and also, as we have already discussed before in the starting of this video, why we need this classification. You can now clearly tell what is and compare different classes of malocclusion, and it will be very easy for the documentation. You can also diagnose it just by looking at the picture, just by looking at the problem, what is the problem, and it will also help for the treatment. Thank you.